Thank you for your time. Thank you for your willingness to stay. I know it's a little bit long. I just want to make sure I can turn. I'm delighted to be here at the First National Filipino Health Equity Symposium. My colleagues have done an excellent job in presenting the serious health disparities that are facing Filipinos in the United States, including obesity, cardiovascular disease, hypertension, and certainly medication compliance and health behavior change. I'm here to present, you can change the slide. I'm here to present two of my novel UCSF Filipino lifestyle interventions research studies that are addressing these health disparities facing Filipinos today. But more importantly, I am also going to emphasize the importance of the Filipinos and the Filipino community to get involved with these research studies. These are one of the first randomized control trial research studies for Filipinos that have ever been done. And I'll talk about the funding too. I'll be giving a brief overview or summary of two preliminary studies that we did to design and develop these lifestyle interventions for Filipinos. I'll give a brief overview of the two Filipino pilot randomized controlled trials currently being conducted at the University of California, San Francisco Institute for Health and Aging. And I'll also be talking about the importance of the Filipino community getting involved with these and participating in these research studies. Next slide. Well, the first preliminary study that we did was with the Asian American Research Center for Health at UCSF. My colleagues and I did an analysis of the California Health Interview survey data that's a representative sample of all the racial ethnic groups here in California. We looked at and analyzed and wanted to assess the Asian Americans' risks for chronic disease, and we looked at the 6 major Asian American groups, subgroups in California, which were Chinese, Filipinos, Japanese, Koreans, South Asians, and Vietnamese. And what we found, excuse me, can you go back? What we found confirmed the huge health disparities facing the Filipinos. Filipinos, compared to all the racial ethnic groups here in California, were the #1 group with the highest rates of obesity, type 2 diabetes, and sedentary behavior. In other words, we were the least likely to be physically active compared to all racial ethnic groups, and that includes that includes African Americans and the Latinos. And then the Filipino Americans were #2, second to Koreans for hypertension among all Asian American subgroups. Next. So how do we address these issues? Well, what's important, especially the health disparities, what's important is that you need to understand that prevention is the key. It is a more easier way and more cost-effective to prevent these chronic diseases rather than to treat the disease. You only have to lose 5 to 7% of your weight to reduce or delay the onset of diabetes and heart disease. Currently, the Diabetes Prevention Program, which is a weight loss program promoting physical activity and healthy eating, has been very effective. It's been instituted since 2002 in the general population. But it's very labor intensive. It requires a lot of staff, and it can be costly. And also, it can be burdensome to the patient and participant because you have to attend 16 clinic visits, face-to-face clinic visits over a 6-month period. A more cost-effective way and an innovative way would be to use digital technology, which is ubiquitous across the whole United States and also in the world. More and more people, the majority of the population, are using digital technology. Interventions could be delivered through a mobile phone, a tablet, or a computer. It would be more cost effective because it would require less manpower and also less clinic visits. and it would have a wider reach in the larger community because majority of the population are now using digital technology. So the question is, how are Filipinos using digital technology and what do they own? So we conducted another study which was called the Digital Link to Health Survey Study, which was published in the Journal for Medical Internet Research last year. We assessed, we wanted to see how Filipinos in particular use digital technology and what do they own. And what we found are that the Filipinos were, let me go back. This is a table, it's just a summary of the results that we found. And basically I want to draw your attention to the row or the column that's Filipinos. It's the one highlighted in yellow. And it has the round circles around some of the results of the study. But what we found were that Filipinos ranked first and second as the highest users and owners of mobile phones, smartphones, and computers. They were highly likely to use the internet, text, email, and they were also highly likely to use social media, Facebook and Twitter. But what I also want to address your attention to is the last row, health apps. Filipinos were one of the highest groups that were downloading mobile health apps. So next slide, please. These preliminary studies were very instrumental in the design and development of two novel pilot lifestyle interventions for Filipino Americans. I received funding for two randomized controlled trials for Filipino Americans using digital technology. These are weight loss interventions. They're programs delivered through smartphone, tablet, or a computer. We use a pedometer to measure physical activity, a mobile health app to track health behaviors, and the private Facebook group to provide some of the education and also to provide social support. The two studies are, the first one is the Filipino Americans Go for Health weight loss program to prevent heart disease. It's funded by the American Heart Association. It is for Filipinos with type 2 diabetes on metformin. That's oral medication, not using insulin. The second study is the Filipinos Fit and Trim Weight Loss for Diabetes Prevention Program funded by the NIH, National Diabetes, Digestive, and Kidney Disease. This particular study is for Filipinos who are overweight and pre-diabetic. That means that they're at high risk for developing diabetes, but they have not been diagnosed with diabetes. Both these studies are feasibility studies. In other words, we are looking to see if Filipinos will step up and participate in research studies. And then also we want to assess the preliminary efficacy. In other words, we want to see if these lifestyle interventions have the potential for reducing the risks of heart disease and diabetes in Filipino Americans. So next slide. So this slide just gives an overview of the goals and the participant eligibility for these studies. These are 6-month weight loss programs. You only have to come in once a month. Most of the education, most of the coaching, most of the tailored goals are all done through a smartphone, tablet, or a computer. The first study, as I discussed, the Filipino Americans Go for Health are for type 2 diabetics on metformin, oral medication to prevent heart disease, for Filipinos who are 18 years and older. The Filipinos Fit and Trim study are for overweight pre-diabetic people who do not have diabetes to reduce their type 2 diabetes risks for Filipinos who are 25 years and older. Both these studies require participants who have no disabilities that prevent them from walking at least 20 minutes. And then also the participant should have a smartphone or a tablet. The smartphone can be an iPhone or an Android phone. Next slide, please. But the most important thing is that we need the Filipinos, the Filipino community to support these studies, to get involved, participate in these studies. Filipinos in the past or have been sort of hesitant and cautious in participating in research studies. And this could be due to cultural beliefs or misconceptions about healthcare services. But nevertheless, we need you to please support these studies. These studies aren't for me. These studies are for the Filipino community and for the Philippines. The Filipinos here in the United States. We need your help because these studies lay the foundation for larger randomized controlled trials that actually focus on health disparities so that we can disseminate these interventions throughout the nation to other Filipino communities. But we need you, otherwise these studies will fail if without your help. So how can you help us? We need you to participate in our studies. We particularly need Filipinos with type 2 diabetes on metformin taking oral medication, not insulin. That's the Filipinos Go for Health weight loss program. The other study is pretty close to getting the total participants that we need. That's the pre-diabetic for Filipinos who are pre-diabetic and overweight. So if you're interested in our studies, hello, could you go back? Thank you. If you're interested, can you go back one more slide? So how can you help us? You can participate in these studies. You can encourage your families and friends to participate. You could spread the word in your Filipino communities, and if possible, please post our flyers at your grocery stores, your churches, and your meetings. The next slide. And if you're interested, this is the contact information, but you can talk to me or Esther Aure Navarro. She's in the audience in the back. We're taking signups for Filipinos who are interested in these studies, and we'll be contacting you to screen you for eligibility. The other thing is if you're an organization or you're a church group, we're willing to speak to your organization or church group, and please talk to us after this program. Next slide. Thank you very much for your time and consideration and listening to our important studies being done at UCSF for Filipinos and addressing health disparities. Thank you very much.
Thank you, Dr. Benner. So remember, if you have family members that have type 2 diabetes and are on metformin or they're pre-diabetic, seek out Dr. Bender. She's looking for participants. All of her work is based on scientific evidence that has shown that participation in programs like these reduces your risk of diabetes by 58%. So, you can cut your risk in half if you join these studies. Okay, so our last presenter, who was gracious enough to sit through all of the entire symposium, but not least, is Radura Ursua, MPH. She is an MPH. She's the Director of Programs at Asian Pacific Partners for Empowerment, Advocacy, and Leadership, a national health justice organization where she oversees multiple health programs addressing tobacco, cancer, food, and active living issues. She was happy to, I got to know Radura when she was living in New York City, and we've collaborated on a couple of projects, including the one that I mentioned earlier about living in the U.S. and how it contributes to obesity. But where in New York City, she lived for 9 years and was working with the NYU Center for the Study of Asian American Health, and she directed an NIH-funded community-based research study proving the effectiveness of the community health worker model in improving hypertension among Filipinos in New York. So she has a lot of experience working with the community, using the community health worker model. She'll talk about that, as well as address issues of the U.S. environment and policy. Okay, let's welcome Radura.
Thank you, Amy, and thank you all the organizers for having me here today. So, as Amy mentioned, I'll be speaking a lot from my experience in New York, where I led that project addressing hypertension in the Filipino community via a community health worker model, but I'll also share different strategies that was used in the community to address heart disease and obesity and chronic disease from more of a policy, systems, and environmental perspective as well. So I represent Appeal. It's a national social justice organization that's actually based out here in Oakland, and a main focus of our work is around tobacco control and also healthy eating and active living, and again, looking at these issues through a social justice type of lens. So we do a lot of leadership development with a lot of the stakeholders in the community who can implement the different types of interventions out there to address chronic disease. And so we provide these wonderful trainings, and we've been fortunate to have federal funding and foundation funding to support these wonderful programs that are being implemented locally throughout the U.S., including the Pacific Islands as well. But one key model I'll be talking about is a community health worker model. Like Amy mentioned, this is a model that we had implemented out in New York, where there's a really large Filipino population in both New York and New Jersey. And this is a model that really shouldn't be, it shouldn't be an unfamiliar model to our communities, given, I mean, what does it sound like in the Philippines? What is a model that we know of that is this community health worker model? Exactly, so the barangay health worker model, right? We know that that was a very effective model out is still in the Philippines, whether it's in the rural communities or even the urban environments. And so we utilize this model in the New York, New Jersey setting, where these are individuals who they play a very unique role compared to other health providers, right? These are individuals who come from the community, they know the language, they know the culture, but more importantly, they have these shared experiences with the community members that they're serving. So either they themselves were recent immigrants, or had at one point been a domestic worker, or themselves are a cancer survivor, or have hypertension and had to deal with obesity. Whatever it is, they have these very specific shared experiences that enable them to really be trusted by the community, to work with them and really coach them to engage in healthy lifestyles, and also connect them to the various health resources that is going to help keep folks healthy. So can you go back 1 second? So they play all these different roles, and beyond just coaching individuals on lifestyle modification, they play this huge role as community organizers. We know their strength is really knowing the pulse of the community, and really engaging a lot of the key stakeholders in the community that can come together and really implement these types of strategies that are going to address heart disease, chronic disease on a community-wide level. So time and time again, there's plenty of studies out there that have shown how effective the community health worker model is, and one of our leaders out in New York, who was a huge advocate for this model, would make presentations to hospital administrators and a lot of these key decision makers about why this is an important model to invest in, and it's been shown time and again that there's a huge return on investments in this model, where for instance, you look at the return of investment of $2.28 per dollar invested for the study that was done in Denver, showing that there's a lot of value in investing in the community health worker model to really create a lot of these changes that we're looking at. So the way that we had implemented this model out in New York, and it has been replicated in many other Filipino communities as well, we used this wonderful resource that was developed by the National Heart, Lung, and Blood Institute, and I noticed it's out there on one of the back tables, but it's this wonderful curriculum that has already been tailored to the Filipino community. So it has examples of, healthy recipes that, or healthy adaptations of Filipino recipes, and examples of, what it takes to quit smoking, and what it takes to manage your hypertension and get active. And so this was a wonderful tool that we didn't have to really create any new type of resource, because we said, let's utilize this curriculum, and we adapted it to make it more feasible, given what we heard from the community members before we implemented it. They said, well, 10 sessions might be a little too much for us to attend, so we narrowed it down to 4 sessions on these different health issues. And so it was a great tool that we were able to use to really get the education out there. And just one slide on the results of our study. It was a randomized controlled trial funded by the National Institutes of Health, and this is being submitted to a journal in the next week, actually. But we showed that when we compared the two arms of our study, so there was the treatment group had a more intensive sessions with the community health workers. They worked with them for 4 months with one-on-one and group sessions on all the different items that were in that curriculum, and compared to the less intensive group that really just got one session. And so we saw that there was a larger reduction in blood pressure for the group that had more interactions with a community health worker. And we saw that at the end of the 8-month period that 85% of the folks that received the more intensive intervention had their blood pressure under control compared to the less intensive group, who still did show an improvement, not as drastic as the other group, but it does show that even with one session, you also saw improvement in blood pressure and blood pressure control. So I invite you all to think about, beyond the individual, beyond the lifestyle changes and all the behavioral pieces that we've been discussing all day, to think about, well, what are all the different levels of influence of those behaviors? And so you look at this model that was being promoted by the Institute of Medicine, for instance, that looks at all the different levels of influence of health. So beyond the individual, where we have, where we're trying to impact knowledge, attitudes, beliefs, behaviors, we have the interpersonal level, right, where this is about the families, the friends, the social networks. And so we spoke, one of the speakers spoke about that earlier, about how are we engaging the families of these individuals to provide that support network so that they can continue to be healthy. And then you look at the organizational level, take it out a step, and we have wonderful examples in here, West Bay and Philippine Nurse Association, and a lot of folks are part of different faith-based organizations. And how can these institutions play a role in implementing different strategies to address chronic disease? You take it out another level and you look at the community level, where you look at the built environment and you look at what's happening out in the community as far as access to healthy foods, or what is it in the built environment that's preventing or facilitating healthy behaviors such as physical activity. And I'll give you an example of that. And then the last level is around policies, laws, and kind of also the cultural norms that are out there that impact our different knowledge, attitudes, beliefs. So I'll give you a few examples of that. And this is all really looking at also what's called the social determinants of health, where it's this concept that health starts in our homes, it starts in our schools, in our workplaces, in our neighborhoods, in our communities. And it's one thing to teach folks how to lead healthy lifestyles, but the idea that why treat people and send them back to conditions that made them sick. So we can educate an individual and say, hey, you need to walk 30 minutes a day in your neighborhood. But what if their neighborhood isn't really safe and they don't feel that that's a reality for them? And so we look at different concepts such as public safety and what are the social cultural norms that are preventing us from being healthy. Do we have access to healthy foods? We've seen that a lot of low-income neighborhoods where there's a lot of communities of color that are living there may have fewer grocery stores, but a lot of fast food spots that are within their community. So to think about that, think about what are the different social determinants that are affecting our behaviors. And neighborhood walkability too, to what extent, we think of urban sprawl, and we think, in some of our communities, everyone gets in a car and we drive, to the next, to all the different fast food restaurants or whatever it is that's out there, but, we're less inclined to walk because maybe just the way the community is laid out as far as urban planning, that things are just spread out. So these are all things I invite you to think about, and how can we address these different factors. And then in our work, we really engaged a lot of sectors within the community. So the idea that, it really takes a village to build a healthy community. And these are examples of all the different stakeholders. I would imagine it's like a lot of the folks that are here in this room, whether they're you all are the youth in our community, and the community organizations, the faith-based organizations, the academic researchers, health providers. And so in our case, we engaged all these different sectors to implement these different interventions. For instance, the faith-based organizations, a great strength of theirs is oftentimes they might have a health ministry that they're building, where individuals from the church community themselves can be these lay health worker type of folks, right? And they can check in with the members in their church community to coach them on how to live healthy and connect them to a health provider. Other examples are elected officials. How do we engage our elected officials to really support a lot of these types of interventions or policy changes that are going to make available and accessible these opportunities to eat healthy and have access to healthy foods or have access to safe places to play. So at Appeal, we talk a lot about how to influence change at all these different levels, at the policy level, at the systems level, at the environmental level. And these are just a few examples. You know, you can think of, when you think of policy, it's not just legislative policy. We can think of policy at an organizational level, at a community level. And so an example of a community policy could be anything from supporting CSAs, the community supporting agriculture, or establishing a community event that you're throwing and establishing it as a smoke-free event. You know, we have examples such as these toolkits that will teach organizers of events on how to promote their event as a smoke-free event. It could be a church adopting a policy that when they are going to have the programming after the service and are serving food that's going to celebrate the community member's birthday or whatever it is, that there is this policy that we're not going to serve soda and we're going to only serve brown rice or whatever it is that's going to be realistic for that community. It was wonderful that we had Supervisor Wiener here earlier talking about the soda bill. And so when you think of legislative policy, it can touch on anything from the tobacco tax to the soda tax and all the different types of legislative policies that are going to impact change. Systems change. One way that we are trying to push to sustain, for instance, the community health worker model is to think about, okay, how do we integrate this into the current healthcare system? Oftentimes we'll see community health workers working out of a community-based organization, but they may not be, oftentimes the funding might be very grant-focused, very time-bound, very disease-specific, but what are ways that we can integrate community health workers truly as members of the healthcare team, as care coordinators, as individuals who either get hired by the hospitals and health systems, or can that organization that employs a community health worker be sub-granted or contracted by the hospital to really play that role as the care coordinator and a lifestyle coach. So there's examples of how Medicaid reimbursement could happen now for these types of services. And then environmentally, what are ways that we can increase access to recreational facilities, open spaces, community gardens, and I love that there's these wonderful vegetables that are being sold out in the back there. I don't know if that's from somebody's backyard, but that's another strategy. How do we promote a lot of these strategies that are very, are very much part of our culture, part of our heritage? And so I'll end with an example of an environmental change piece, and this was a really wonderful project that was implemented in New York, where it was called Play Streets. And this, it was a very popular strategy that was implemented in other parts of New York, but never really with the Asian community. This was actually one of the first ones that targeted the Asian community. And what this involved was working with the health department and all these various stakeholders, like I had mentioned earlier, and especially our elected official, our city council member who represented this neighborhood, to really get behind getting a permit to close the street down to traffic, so that we would have consecutive Saturdays in the summer where children, families, anyone in the community can just come out, and it's almost like a block party, but it was very focused on healthy living. So it was about coming out to have a yoga session or play these fun cultural recreational games, or We had one of our Filipino cultural groups lead dance lessons. In the bottom left is even our city council member himself playing badminton with the children and learning martial arts. So whatever it was, we really leveraged the resources that were existing in the community. These are all folks who volunteer their time. We had the Filipino Badminton Club teach the youth how to play badminton, and it really takes leveraging the existing resources that we already have in our community. And this was a really well-received event, and it happened again the next summer in a different space, actually as a shared use type of strategy in a park. But it was a really wonderful way to just not only promote active living, but it was also a way to really create community cohesion, right? We were bringing generations together. We had the young and the older generations coming together to play, basically, and not sit in front of their computer, not sit in front of their PlayStation, so that they could actually enjoy the sunshine and get out there and be active. Just like many of us grew up, being able to play in the streets in a really safe space. So this is just an example of a strategy to think. Yes, there's a lot of the education that's needed to motivate folks to engage in healthy behaviors, but then there's also this huge need on how do we create those opportunities in our neighborhoods, in our environments, so that folks can actually engage in these behaviors. So I'll end with that, and I just wanted to acknowledge the groups that were critical in a lot of this work, and that's Kalusugan Coalition, a Filipino community-based organization out in New York, and the NYU Center for the Study of Asian American Health, who had received this funding to make this project available. So, and that's my information if you want to get a hold of me. Thank you.
I want to thank Rhoda for her wonderful presentation, and not for showing my picture, because I remember participating in one of those play streets and they caught me trying to do a push-up on the street. Anyway, okay, we've talked enough. I have to thank everybody that has stayed throughout all 6 presentations. And we are we're happy to see that you're taking this seriously. But we've talked enough, so I want to turn the podium to you for any questions. Do we have, and Rudy or Esther, do we have questions on the pieces of paper, or should we just go ahead and?
We'll just go ahead and have a Q&A.
Okay.
I don't know if we need do we need a microphone for anybody to speak, or
Well, it's not.
do you think you can speak loud
All right.
enough?
Well, I don't think it'll go all the way back. Okay, so anyone have any questions? Come on, we all have questions. You want to talk?
Yeah, my name is Phil Delacruz. I am in the board of directors of the Filipino American Society of Architects and Engineers, and you all have a tremendous amount of knowledge, abilities, and skills, experience that we really need, because we are embarking on a sustainable village program to build villages in the high-end typhoon area in the Philippines, and we'll be using modules of about 100 homes each. And in the village, we will have a community center where we will have included 4 programs: health and well-being, number 1; number 2, education; number 3, livelihood; and number 4, self-governance. Now, you're addressing the 3.8 million people, Filipinos in the United States to do this forum, and that's tremendous. But with me in my work, I did not have only the train. I was in the military as a lieutenant colonel. I had up to 200 people that were under me. And I'm a civil
Just pass on
engineer
the mic,
also.
whoever
I
wants
had
to answer,
a team
just please pass.
of about 200 people on the staff. But what we are doing here, what you're doing here, is a matter of declaring war on diabetes, my military side. And you are declaring a project to go to the moon in 10 years on my engineering side. That's a daunting task, however way you do it. I don't know how you're going to do it traveling around, because we all know as educators that what we learn in something like this, we only remember 10% in about a week. So where is all this effort going? Nowhere. Now, my point is this, is that in my careers, I've had 2 careers, is that you need to be able to decentralize what you're doing. You need somebody in each of the Filipino groups, the community groups that you're dealing with, bring them into your someplace, train them so they can go back and train their group, within their own, comfort zone, develop competition among them, reward them, develop a benchmark among the group, and then reward them when they achieve from 50% diabetes to 20% diabetes, send them a plaque, recognize them in the papers, that kind of thing. You need to involve them. You need to get all this thing down to the community, and that's what we're doing. Thank you.
And just to address what you're basically saying, I already received 7 doctors from all over the United States requesting that we do this same symposium in their areas. So we're going to be communicating with them directly at some point. But before the year is over, we're going to have this symposium in Los Angeles. We're going to have this in San Diego, and then we're going to have it in New York and Washington. So, and just to address what you're concerned, because we're a national organization, we are planning to have this thing edited and put into a CD so that we can distribute it to all nonprofits and schools where there are pockets of Filipinos. And we're also going to upload this thing on YouTube, so for everybody's reference. And if you look at the programs that you have, on the back of the programs are the bios of all our panelists, and their email addresses are also there. So if you have any questions, if you have any specific things that you want to address with any of the topics that they discussed here this afternoon, please feel free to look at the back of the program and send them an email. I want to thank you because without you, of course, we're not going to be able to get the awareness and the information out. The main thing that I'm trying to impart before we all go in our separate ways is that we need to raise the awareness about the campaign that we are doing. We need to talk about this, and we're not going to talk about this by just having one symposium. We're going to have this in the national level, and we're going to have a national conversation. So thank you very much, ladies and gentlemen. And you have a question?
No, I have a real quick comment on what Redora had to say.
Oh, go ahead.
Yeah.
Maybe you can come up here and
I'm the one that was passing out the No Filipino Farms, No Filipino Food, and support the Filipino farmers. We are down to one last farming community in California, and that's in Orosi where we farm. But just to pick up on what you've said, and that's about community-supported agriculture. Does everybody know what CSAs are? Well, it's what you do in the village in the Philippines. You get your vegetables straight from the farmers, right? And we're trying to implement this coming Thursday in Fresno. The Filipino farmers will be sitting down with the USDA and promoting lobbying. Yeah, we're going to be lobbying for our proposal to support the creation of a CSA for Filipino farmers. Actually, for the Filipino community. I think we underestimate ourselves. 1.5 million Filipinos in California. We're the largest Asian American group. And what that tells us is that there's a large potential for the last of us who are still farming to sell directly to your households. So I hope that you take that, into consideration. I just want to add something very, very quickly. I'm born in this country. My family came through Hawaii before World War I, working on the plantations and then coming here to the mainland in the 1920s. And my father's generation, they lived to be 80 and 90 and over 100 years old. And when my Apo died, he already had dementia. He had, what's that when your hand quivers? Parkinson's disease. And the doctor told us that he had a series of strokes. And I was so shocked. After the funeral, I went to the Philippines and I went to our family village. And you know, my relatives, they really wanted me to meet everyone that knew my apo. And they took me to visit this woman. I'm sorry, I forgot her name. But she remembered the very day my father walked out of the village. Just real quick. And she was alert, disease-free. You know, I'm thinking, wait a minute, what's happening here in the Philippines? And what's happening in the US? What has unleashed the epidemic of diseases in this country? And that's why I think CSAs are so important. Before you get to the institutions, the health organizations and all their insurance, I mean, let's face it, our medical industry is controlled by big, powerful insurance corporations. Before we get there, I think we need to connect to us, the Filipino farmers. So please support us. I'll be adding you to our email, so please respond.
Thank you. Okay, I guess we're gonna end with a little celebration here. For a few minutes.
You really didn't know that I invited you all here because
This isn't healthy either.
it's my birthday.
So if everybody could wish Tito
But this
Rudy
is an
happy
incredible
birthday.
birthday for me because this is one of the most meaningful things I can do for my birthday. And I want to thank you all for being here. And I know this is not so healthy, but
Portions, just remember.
Portions, yes.
but I'm gonna grow the candle.
And I think there's
You
enough
will
of us to
please
get a
Yeah, to
sing
get
happy birthday. You will honor me by singing happy birthday. 1, 2, 3.
Happy birthday to you. Happy birthday to you. Happy birthday, dear Rudy. Happy birthday to you.
Thank you.
Rudy, are we done, or can people still ask questions, or are we done?
We're done.
We're done. Okay, great. Well, thank you so much, everybody. Well, I guess the panelists will be around if you have any burning questions.
I have a question. Just to let yeah,
Guys, I think people still have a lot of questions, so why don't we go ahead, if you don't mind, and if you want to stay around, feel free. So we have, if the speakers are okay?
Yeah.
Okay, so let's go on.
First, I want to thank our panel speakers. I think it's a great, great program. My question is to address the health style medicine or health style management and preventive care. I think we should start with our grade schools, with the kids, with the instructors, and also if we can expand on mindful eating, mindful shopping, because what we have in our refrigerator is really what we eat. It's what we shop. So eating mindfully and shopping mindfully, I think that's probably, start from our little kids before they get conditioned, right? Okay, thank you.
Okay. Is that it? Okay.
I had a comment. We're running a collaborative visit at Stanford for our diabetics, and so we were presenting this plate with multiple colors. So multiple colors is good. So one of my patients said,